Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, Fairfield Medical Center, Dagger Law, and the Frank E. Smith Funeral Home.
Welcome to Fairhope Hospice Today. Hi, I'm Kim Shook, Community Education Coordinator here at Fairhope Hospice and Palliative Care, home of the Pickering House.
And I am Kristen Glazier, President and CEO here at Fairhope Hospice and Palliative Care, home of the Pickering House. We are out here on a beautiful sunny day, right out front.
Yes, right out front of the Pickering House in the portico area. And we have our guest today is Laura Kennedy, our community educator, and she covers the Perry and Hocking and Athens area. So welcome.
Thank you.
Thanks for coming up to see us today. And
thank you for inviting me.
You guys have been sharing lemonade with some of our staff.
We sure have.
Yeah.
Quite a few.
We bring lemonades out to the community in several places and over the last couple of years, and it sure brings sunshine to all of those that we serve and their facilities, and bringing a refreshing drink to the staff and their patients.
Yes,
Much needed.
Much needed.
Yeah. So tell us what areas you cover with Fairhope.
I cover Athens, Hocking, Perry County, and then I dabble in a little bit of Vinton, Muskingum, Pickaway, and a few little parts in Fairfield County.
So you put a lot of miles on your feet.
I do.
Talking about Fairhope and what we do.
I sure do.
Nice.
And sharing our message and what kind of care we can provide to them. And
Yep, most definitely. Doing events with the seniors and the staff and residents of facilities and things like that.
And the senior centers, what senior centers do you cover?
I do senior center in Perry County and Hocking County.
Okay, and then we work with the hospital in Hocking.
We sure do.
As well.
We work very closely with the hospital, Hocking Valley Community Hospital.
Great.
We've had a long partnership with them.
We have.
Just in our signature event that we did, our Fairhope Celebrates Life event, we honored them with an award just because of the longevity and the support that they've given us for so many years since we started.
Definitely, and they were very, very grateful.
They were. That was a good day.
Yes, it was.
Can you tell us? Oh, I'm sorry, Kim.
No, go right ahead.
Can you tell us a little bit about how you got started here with Fairhope?
My experience is about 15 years in skilled nursing facilities, long-term care, and I've worked with people of Fairhope for many, many years, and the opportunity came about, and I took it.
Thank goodness. We're glad you're here with us.
I'm happy to be here.
And you cover physician offices, so tell us about how you do the relationship building with them.
I go in and make sure that they have everything that they need. If they have any questions, we offer educations to their staff free of charge. Lunches, we'll provide lunch, do educations for anything they may need, and just keep that relationship open, that they know that we're there anytime.
Laura, you know, Kim and I talk a lot, and we do TV and radio together, but you know, what is it that you feel like is your goal each day? When you get up and you go out and you're doing your marketing and education about what Fairhope is, you know, what's your goal? What's the primary message that you want people to hear?
Primarily, my goal is to make sure that anybody that feels that they need help for anything, they learn about us and know that at the end of the day that they're going to call us because we can provide that help. And just to make sure that they know of all of the things that we're able to provide for them between social work, chaplains, nursing, aides, any help that they need. We'll try to provide that, and if we can't, we know that there are resources that we can tell them about and get that help they need.
That message probably has to change every day. Depends on both of you, wherever you go. That day you're going to a doctor's office, physician's office, or maybe you're going down to the park or the fairgrounds, and that message changes, you know, how people receive what you're telling them and then what they need to do with it.
Yes.
So you really have to know your audience.
You do.
Yeah.
You do.
Good.
I know we advocate on health fairs and all the different relationships that we work with other referral sources. And then we work as a team to collaborate with all of our community partners. And we work with them as well and to get the message out, to let them know with their patients that they're caring for can know that they can call Fairhope when they have a time of need for our services that we provide.
Yes. And so it doesn't matter what county, where someone lives, you know, if when they're in our service area, they have one number they need to call. It just makes it easy. So I think sometimes people probably feel like, well, you know, the Pickering House in Fairhope is located in Lancaster, so what do I do if I live in these areas?
Still call that number and they will get someone out. I've actually had 2 people in the last 2 weeks that has reached out to me, and I gave them that number, and I've since talked to them, and they've mentioned how fast the response. They didn't expect the response to be as quick as it was.
Good.
But it was, and they were so grateful.
One thing that we talk about an awful lot is just how hard it is to make that first phone call. So when you're out and you're seeing clients and physicians and just people that come up and stop you at the street at these events and say, well, what do? I don't know how to do this. You know, what I think I see, and you probably see the same thing, is that making that first phone call is really the very hardest step, because you make that call, you don't know what you're going to get on the other end, you don't quite know what to say, what to ask for. So I always try to let everybody know that it's just, we want it to be easy. The first call is the hardest, and let us take it from there and just transition and really get you in the right spot.
That is definitely the response that I received from those 2 different family members, that it was seamless, and it was way more easier than they had expected, and they were grateful for that.
Good.
They send a nurse out and do the assessment and get the equipment in there that they need, and all of our staff that the team approach, they make a visit to that patient that has just come on service. And you can call the number as easy as calling 740-654-7077. Even though it's a hard call, it's pretty simple to just make that phone call. If you have hospice questions or palliative, you might have a patient or a loved one that needs our care.
Yes, absolutely.
So we have lots of great partners in the community. And do you want to talk about our newest partnership with the radio station?
Yeah, so this is kind of exciting. Recently, we have partnered with Sam FM in Logan, and so you're going to hear some Fairhope voices there. We're doing a bi-monthly show where we just talk really about what Fairhope offers, the events and the things that, you know, Laura is that she's working on in Hawking County and Perry County, and just really trying to get the word out. You know, Sam FM is a great radio station, and they have a lot of listeners from all areas, and so we just thought that would be really something that we wanted to do, is to make sure that all the great folks in that community have a really good chance to kind of hear us and to get some more information out. So we're excited about that.
That's great. I know it is the local, and it's been the local radio station for many, many, many years.
Yeah.
So that is the perfect way to reach the locals.
Yeah, and we talk a little bit about that, how that started too, was the senior center that you're very involved with. There. Do you want to talk about that a little bit?
I can. The Scenic Hills Senior Center in Logan, it's on Spring Street. We are very, very involved. You'll catch me in there every week. I'm doing bingo on Tuesdays. We've actually started from June until November. We are their main sponsor for breakfast, the first Tuesday of every month. So stop in there and grab you something good to eat from 8 to 9:30, and then you can stay and play bingo.
That's win-win. Breakfast and prizes.
It is.
I know we do education in our facilities for staff. It's coming back more now that we're able to get in our facilities where we educate the staff. And that provides extra information for the staff to be able to recognize when they may have a hospice patient. Do you want to list some of the educational pieces that we do?
We do several on grief to help the staff to help people prior to us coming in to handle some grief, even family members to handle the grief of hearing a difficult diagnosis or, you know, a passing or anything like that of one of their residents. Even the residents become families with residents, so the other residents. So when one of the residents pass, that grief is heavy too. So we do grief We do several different educations for the staff and give them free CEUs to continue their education that is a must every year. So
What do you find when you go to the physician's offices? What are some things that they ask you? Either that they want education on or just questions that they may have, because it feels like that would be something that you have to do over and over and over again, just because it takes a while for everybody to kind of grasp the Fairhope, the hospice concept, the palliative concept. So what are some things that you see when you frequent the doctor's offices?
Several times they've wanted like the forms that we have of like hospice versus palliative, like how to know the difference, how to spot when it's good to call and make that that referral, and what to make that referral for. Is it for hospice? Is it for palliative? So they like to have that. They like to educate their staff to just pick up on different things, what a family member may say.
It just varies.
It varies every day. They have a different need every day.
And the one thing I think that I try to remind families too when we talk is that it's okay for them to go to the physician and say, this is what I think. I need some more help. This is what I'm hearing. This is what I think I need. Can you guide me in that direction?
Yes.
Because we know that's a really hard topic to talk about, even for physicians. So I think sometimes the more we can educate families about how to talk about that and bring that, that conversation up, the better off, we'll all be.
Definitely.
Yeah.
And a lot of times it's the family members that have that heart-to-heart with the actual patient and to say, I feel like it's time we get some help, because the patient can take that burden on themselves, but once the family steps in and tries to help them with that decision, they feel more at peace with it.
I totally believe that.
So if you have any questions regarding our hospice and palliative care needs, give us a call at 740-654-7077 or check out our website at fairhopehospice.org and our toll-free number 800-994-7077. So thank you for joining us on this segment, and we'll be right back.
When we came here when Dad was sick, you walked in the doors and you knew you made the right decision.
Yeah.
They treated Dad like he was so special.
Like he was the only one here.
And they not only treated our dad, but they treated our family.
Yeah.
We had cots, we had soup, we had food. I mean, they treated us like part of the family.
Yeah. The moment that you're told that you have cancer, so many things were going through my mind.
I had this pain that kind of doubled over, and FMC got me the help that I needed, so I ended up surviving.
Fairfield Medical Center has helped me get through what was the hardest 6 months of my life.
When I first came to Fairfield Medical Center, she was probably having an allergic reaction. They saved her life, and that's why she's here today.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Dagger Law has been part of the Lancaster community for more than 110 years. This is where we live and work. You'll see us at festivals, sporting events, and all around town. We consider our clients as friends, and we walk alongside you through challenging times. Whether you're a growing business, a changing family, facing litigation, planning your future, or dealing with land issues, we're right here. We are local. We are trusted. We are experienced. Dagger Law.
Sam, Elmo.
Oh, hey, Julia. You ready to play band with us? I'm going to play my clarinet.
And Elmo's gonna play his drum. Drum loud.
Oh, well, you know what to do, Julia.
Julia knows.
With Julia's autism, loud sounds can be too much.
But she still loves to make music. Play band.
Screening for autism can make a lifetime of difference. Find out more at screenforautism.org.
Welcome back to Fairhope Hospice Today. Hi, I'm Kim Shook, Community Education Coordinator here at Fairhope Hospice and Palliative Care, home of the Pickering House.
And I am Kristen Glazier, Fairhope Hospice and Palliative Care President and CEO. And if it looks like we are squinting today, we are. I'm not complaining, but the sun's beautiful and we're outside and sharing some lemonade.
Yes,
and
it's a little breezy.
Yeah.
So just a great day to be outside of the Pickering House and sharing our information with all of you. And we have our guest today is Laura Kennedy. Welcome back.
Thank you.
And she's our community educator in our Southern County area that we cover. So tell them again what areas that you cover.
I cover Hocking, Perry, Athens, a little bit of Vinton, a little bit of Muskingum, Pickaway, and a little bit of Fairfield.
And we're about an hour, we cover about an hour radius of the Pickering House because we don't want to overextend our patients and our staff when they're in time of need and they need something quickly, we can get to them.
Yes.
So you have lots of things coming up in the month of later here in June and all of July and this summer. So tell us about what's going on in July.
July is the Perry County Fair. It's the 18th through the 23rd. We will have a booth in the commercials building, and come and see me. Stop and see me.
Yeah, it's great to meet the community that way at all the fairs. It's nice to get out in our communities that we serve and just let people know the care that we can provide in their time of need. And so at the fair is a good way to do that because you meet lots of people.
Lots of people, and my favorite part is hearing the stories. People, every day there's 20, 25 that'll say, my family, somebody in my family, my wife, my sister, my brother had your services. So, and they're always willing to share the stories, and I love to hear them.
Yeah, it's just a comfort for people to come to our booth at the different fairs and tell their stories because it brings them comfort to bring up the name of their loved one that was on our service and thank us for our staff that cared for them and their families. So it's a really neat thing. So you'll be there all throughout that week with your display and everything. And there's a senior day at the fair. Tell us about that.
On Thursday of that week is senior day. Seniors will get in for free. And Fairhope will be providing or help providing. We're having a lunch bag, and we'll provide a lunch to the first 200 seniors that come in to receive that lunch.
How many seniors do you think that come through the gates and then stop at our booth?
Well, last year I know we provided 250 lunches.
Wow.
And they were gone within a matter of 15 minutes.
Oh my goodness.
As fast as we could hand them out, they were gone. And then I saw several after that walk by carrying their bags or saying thank you. So
nice, very good.
Yes.
So it's just nice to give them a free lunch and
it is.
Talk with them. And they have music under the pavilion area, and they enjoy that and have lunch. And we all have our referral sources in the community. We are there to talk with them and just share our information. It's just a good time.
Yep. We all partner together to just make it a great day for the seniors.
And so you have some other fairs coming up too?
The Hocking County Fair is in September. It's the second full week in September. We will also have a booth there. It's in the Arts and Crafts building. So come see me there.
Yeah. And different areas of ours that we serve, we're part of all these different, several different groups. And I know you're part of the Pickerington, or the Perry County Senior Task Force.
I am.
So tell us about what that group does.
Perry County Senior Task Force, we meet monthly at the Senior Center, and we just try to come up with ways that we can help the seniors of Perry County. It is actually our group that will be putting on the lunches for the fair at Senior Day, and then we will stay around and make sure that they have anything that they need, trash picked up, and just make sure that whatever the needs are in the community, that we are seeing that. We will provide meals with the Senior Center, and we'll be there to serve them and do bingos, and just we do anything that the seniors may need just to make their day fun.
That's great.
How many members do you have in that task force?
There's roughly 15, give or take. Some people change positions and they don't assign someone new, but roughly 15.
Okay. It's a lot of good work you guys are doing.
It is.
Yeah.
It's fun. It's fun to see the smiles on the seniors' faces.
I'm sure.
Well, it's good to get to know them and build that relationship because, and then you can share different things with them and their birthdays, and they have milestone birthdays, and it's just good camaraderie just to bring cheer to our seniors in the community.
Yes,
absolutely.
It's heartwarming. So I know we have an office in Logan.
We do.
So
Tell
us about that.
The office, it's kind of like a satellite office for the staff. Not really a lot of foot traffic there, but we are in the Hocking County Chamber building, which is on 96 Hunter Street. So if you have a chance, you can stop by and see if someone's in the office. But yeah, it's just mainly a hub for our other staff, our nurses and things like that.
I think that building is important because, a lot of times you guys and the nurses and the social workers and chaplains are out running all the time, and sometimes you need a place just to stop, do some charting, pick up supplies, and then hit the road again. And I think that's just a great, kind of a great, nice middle spot for everybody that needs a little break and take care of business before they get back on the road.
Yes.
Because from this, from what I know and from what you're saying, you keep saying, well, I do a little bit in this area, a little bit in this area, but that sounds like a lot of little bits. So you're always on the road, probably moving and traveling and trying to find something new to get into.
I am.
Yeah, yeah.
And I know we have volunteers that help in those areas and helps you out a lot too. So tell us about how they'll help you at the fairs.
They'll come and just sit at the fair and meet the guests. People walk by, talk to them, see if they have any questions. If they do, they'll answer them and just mingle with them and just be nice.
Yeah. We're kind of talking about the volunteers, so we were happy to have completed our first post-COVID in-person volunteer training. So that's a 6-week course, 1 night a week, and all of our staff, the different disciplines, come in and meet with all the volunteers, and we really give them tons of education so that they can go out to the communities like that and help you and just really talk about what Fairhope is all about. One thing that's really important to remember when we talk about volunteers is it doesn't matter what your talent is, we'll take it. If the thing that you love to do is sit with patients, that's perfect. If you really prefer just to do events, just to go out to different events or come here and help us on the beautiful grounds. So, we would love to have volunteers that are in your area to really supplement what you do. And so we're always looking for great people to come on board to our team.
Yes, definitely.
So anyone out there that is watching that would like to possibly be a volunteer, just give us a call at 740-654-7077 and ask for Twyla Summers, and she would be glad to get you the information about our volunteer program.
Absolutely.
And I know we do grief support in all of those areas, and we follow the families 13 months after their loved one passes. So tell us about how we bring our grief support to the schools down there.
Fairhope has a program where it's the PALS program, and they will go into the school system. I know that they're at the high school, the middle school, and a couple of the elementary schools, and they'll provide just grief groups for some of these children. They'll do one-on-one grief counseling for some children. It's sad times sometimes that we're living in. There is children that are losing grandparents, siblings, peers, parents. So we can go into those schools and help them. And the groups sometimes are better because they get to see that they're not alone in their struggle or their fight, that there's another one of their peers in the same situation, and they can kind of bond that way. And continue to be support for each other.
Yeah,
so.
Someone just like them that's going through that.
Yes.
Yeah. So we've been very, very fortunate that Hocking County and the schools there have really reached out to us and embraced us with our grief and bereavement team to come in and just do that grief support for them. So that's something that it doesn't necessarily have to have had someone who was on Fairhope services, receive services. So it can be anybody that's in that school system that has suffered a death or a loss. And so, that really varies. There's no charge for that. That's just something that, Fairhope and our generous donors help us to make sure that that happens, not only in Hocking County, but we also service Fairfield County and surrounding areas here. So our grief team's very busy. They do great work. And, as our event that we just had, really all the monies that we raised from that went back into that program to just help support those young folks.
Right.
Yep.
Yes, lots of good things. And just any other events you have going on or things that you're doing in your facilities? We cover our assisted livings and our skilled nursing rehab centers. And do you have anything going on in those areas?
I'm working with several of my facilities to get lemonade stands going. And something that I like to add with my lemonades is I do hot dogs and just kind of make it a little thing. And we do it for the residents and their staff. And it's just a good way to show some appreciation to their staff for hanging in there with them.
Yes, and thanking them for all they do. Healthcare workers, they're angels, I swear.
They are. Yep. Well, I think you've got this down to a T, this lemonade thing here.
It's fun.
Yeah, I imagine.
It's bringing it back old school.
Yeah. That's cool.
I know. I do ice cream socials too, and we provide ice cream and all the toppings, so Sunday bars.
Yep.
And speaking of ice cream, we have Virginia Pickering. We do an ice cream social coming up later this summer. So
we do.
We'll have that here at the Pickering House.
Absolutely.
In her honor. So, okay. Well, we covered a lot of ground, and you cover a lot of miles in your area, and we just thank you and appreciate you for all that you do for Fairhope, and it's great working with you through all of this, and just lots of things. If you have questions you want to talk with someone about possibly a diagnosis that you think would be appropriate for hospice or palliative care, give us a call at 740-654-7077. And our palliative program, we can maybe touch on that a minute too, really.
Absolutely. Our palliative program is just really taken off and grown. We currently have 4 nurse practitioners who oversee our census of our palliative patients, and the palliative program really is when someone has a chronic illness that we know eventually will take their life, but not ready for hospice. The physicians, our nurse practitioners work together. We keep extra eyes on those patients, and we just really help support them and work through that process. We talk a lot about goals of life and goals of care and what's most important to them. So if you feel like also that you're just not quite sure which program you want, give us a call as always, and we will point you in the right direction.
Yes. And I know we also work on our veterans programs as well.
We do.
We honor veterans. When a patient is on service, we honor a veteran, and so you're part of that. And then we also do veteran pinning ceremonies that we do in November. So you're busy with that as well.
Mm-hmm. We are. Usually in my area, it's roughly almost 200 veterans that we'll pin from my entire area, but we have different ceremonies, and it's roughly about 200. So that's
sure
a good touch.
That'll be here before we know it.
I know.
Starting to schedule those now.
Yes.
All right. Well, thank you for tuning in today. We've been talking with Laura Kennedy, our community education coordinator in our southern areas that we cover: Athens, Perry, Hocking County, Pickaway, those areas. So thank you for joining us today.
Good to have you here.
Yeah,
good to be here. Thank you.
So again, if you have any questions for hospice and palliative care needs, just give us a call at 740-654-7077 or check out our website at fairhopehospice.org. Also, we have a very interactive Facebook page, and a lot of these events that Laura has covered today will be on there, so you can see how we interact with the communities, and we would like to meet you at one of those events that she mentioned. And also our toll-free number, 800-994-7077. And remember,
celebrate life.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, Fairfield Medical Center, Dagger Law, and the Frank E. Smith Funeral Home.